Okay, so now we're going to speak about the mechanism of venous disorders, the mechanism of venopathies or venous insufficiency. Now, the mechanism of venous insufficiency depends if you have a primary venous insufficiency or you have a secondary venous insufficiency. Basically, so the mechanism are different. We need to know that what in primary venous insufficiency we have a valvular defect. So when you have a valvular defect, what happens is that what normally blood has to flow in one direction. So this is the blood vessels and these are the valves like this. Basically, this is the blood vessels and these are the valves. Normally blood has to flow in one direction and this is the direction of blood flow into the vein, into the heart for the venous return. And now we are supposed to have valves, is it clear, which is supposed to prevent the backflow of blood. The valves are supposed to prevent the backflow of blood. But what happens is that when you have a valvular defect, there is going to be a lack of this valve. So the valve backflow is going to be promoted. And when there is backflow of blood, you now have accumulation of blood inside the superficial veins. Is it clear? And that accumulation of blood inside the superficial vein is going to present as varicose veins. That's why initially I've told you that what primary venous insufficiency can also be called varicose veins. Now, the second one now is a secondary venous insufficiency. In secondary venous insufficiency, you need to know that it is thrombosis. It is the mechanism of secondary venous insufficiency by thrombosis. Now, the thrombosis can either be deep in the cases of deep venous thrombosis, or it can be superficial in the cases of thrombophlebitis. Is it clear? Thrombophlebitis. So those are the different mechanisms. Now, when it is deep venous thrombosis, you need to know that what happens is that we have deep vein. Let's say that we are at the level of the leg, of the knee. The deep vein at the level of the knee is a popliteal vein. The popliteal vein, is it clear? Or let's say that you are at the level of because deep venous thrombosis is particularly occurring at the level of the the popliteal veins, is it clear, in the lower limbs. So, but at the level of the tibial veins, at the level of the lower limbs, the deep tibial veins, is it clear? So let's say that you're at the level of the tibial veins. Now you need to know that what you're going to have, let's say that you have the tibial vein and then you have an obstruction at the level of the tibial veins. Is it clear? What happens is that when you have obstruction at the level of the tibial vein, below the tibial vein, we said that what? We said that we have the arch at the level of the foot. Is it clear? If you remember, we said that you have arch at the level of the foot, and the arch at the level of the foot was both draining into the tibial veins and were also draining into the superficial circulation, which are the greater saphenous and the lesser saphenous. Is it clear? The greater saphenous and the lesser saphenous veins. Is it clear? So let's imagine that there's an obstruction further here. If there's an obstruction, it's going to be backflow of blood. Is it clear? And there's accumulation of blood here. So usually the obstruction is at the deep. When the obstruction, let's say that the obstruction is deep, you're going to have backflow of blood, and then it's going to go and pass now through the superficial circulation. You see, it's going to backflow, pass through the arches, then go back through the superficial circulation in order to bypass this blood flow and to bypass this, and such that at the level of the popliteal vein up here, you can have drainage from the lesser saphenous vein. Is it clear? Or it can drain into the femoral vein up. Is it clear? So it depends on, that is the mechanism of the deep venous thrombosis resulting to varicose veins. So in secondary venous disorder, you still have varicose veins. Is it clear? You still have varicose veins, but the varicose veins here are secondary. Is it clear? They are not primary, they are not inherited. Is it clear? They are secondary to a deep venous thrombosis. Is it clear? Now the next one is a case of superficial thrombosis. In superficial thrombosis, what happens is that you instead have a thrombosis of either the greater saphenous or you have a thrombosis of the lesser saphenous. What happens is that the backflow is going to first start at the level of the greater saphenous. So you may visualize some varicose veins. Is it clear? We visualize some varicose veins, and then the backflow is going to continue such as to bypass the level of the obstruction and pass now instead toward the deep circulation. So when you have a thrombophlebitis, it is going to instead pass through the deep circulation and still produce varicose veins. Is it clear? But the varicose veins in the case of the thrombophlebitis are painful. Is it clear? Because it is the superficial vein that is inflamed. Is it clear? So the varicose veins of the thrombophlebitis are painful. Those veins, when you touch those veins, they are paining. That's why it is called thrombo and phlebitis, with signs of inflammation of the superficial veins. But the varicose veins, both from deep venous thrombosis and primary venous disorders, it is non-painful. That's a peculiar characteristic. Now, after visualizing the mechanism, we are now going to visualize the pathophysiology now, which can result in the complications of the venous disorder.